Hey, redefining fitness here. Cardiovascular endurance is the most important aspect of fitness. It is basically how strong your heart is, which can potentially add years to your life. The heart is the most important muscle in the human body, and if it is kept healthy, then you can avoid numerous health problems. Another reason that cardiovascular endurance is important is because your heart controls the oxygen flow to all your muscles. So let's have a look about cardiovascular endurance here. Cardiovascular exercise has received a lot of attention over the last 15 years as the centerpiece of physical fitness, weight management, and cardiorespiratory health. The term cardiovascular exercise, cardiorespiratory fitness, and aerobic exercise are all synonymous. This kind of exercise requires large muscle movement over a sustained period of time, elevating your heart rate to at least 50% of maximum level. Cardiovascular fitness is the ability of your heart, blood cells, and lungs to supply oxygen-rich blood to the working muscle tissues, and the ability of the muscles to use oxygen to produce energy for movement. This type of fitness is a health-related component of physical fitness that is brought about by sustained physical activity. A person's ability to deliver oxygen to the working muscles is affected by many psychological parameters, including heart rate, stroke volume, cardiac output, and maximal oxygen consumption. Understanding the relationship between cardiorespiratory endurance training and other categories of conditioning requires a review of changes that occur with increased aerobic or anaerobic capacity. As these capacities increase, general metabolism rises, muscle metabolism is enhanced, hemoglobin rises, buffers in the bloodstream increase, venous return is improved, stroke volume is improved, and the blood bed becomes more able to adapt readiness to varying demands. Each of these results of cardiovascular fitness, cardiorespiratory conditioning will have a direct positive effect on muscular endurance and an indirect effect on strength and flexibility. To facilitate optimum delivery of oxygen to the working muscles, the person needs to train or participate in activities that will build up the energy stores needed for the sport. This is referred to the metabolic training. Metabolic training is generally divided into two types, aerobic and anaerobic. The reason your cardio performance can be improved is because the heart is a muscle. And like all other muscles in the body, if you keep working, it will adapt the workload given. This allows us to have a direct control of how healthy one of the most important systems in our body is. But keep in mind, there are other factors that affect heart health, such as cholesterol and blood pressure. Eating right and exercising will ensure that your heart becomes and remains healthy throughout your life. Cardiovascular fitness is related to age, gender, exercise habits, hereditary, and cardiovascular clinical status. Maximum values occur between the ages 15 and 30 years, decreasing progressively with age. At the age of 60, the mean maximal aerobic power in men is approximately 3/4 of that the age of 20. With sedentary lifestyle, there is a 10% reduction in the mean maximal aerobic power per decade. The reduction with an active lifestyle being less than 5%. And as always, before engaging into any new physical activities, please consult a certified fitness consultant to avoid any risk to your body. If you are a fitness professional or an enthusiast, then share these words with your family, friends, and community. Thanks for the view. Subscribe for more Redefining Fitness.